Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Kristi Caracappa. Kristi is the Health Insurance Information Service Coordinator for Washington Hospital. She has held this position since 2009. Kristi provides information to community members to assist them with making informed decisions regarding health care coverage. Kristi can provide assistance with Medicare, Medi-Cal, as well as private insurance and other government or community-based programs. Kristi is a certified enrollment counselor for Covered California, California's health insurance exchange. I'm going to go through the Medicare basics and hopefully I answer all the questions that you need to know. So I want to talk a little bit real quick about the service that I provide here, the Health Insurance Information Service. I'm here all year to answer any questions you have about Medicare. So if you're not in Medicare yet and maybe you're going to be on it next year or coming up, you can call and make an appointment with me and I can do a private consultation and kind of explain things with your particular situation. As we will be going over the basics today, sometimes people have special needs with their Medicare that we can talk about. One of the other services we provide is the Advanced Healthcare Directive, a very important thing to have if you're 18 or over. We strongly encourage you to have one and fill it out. And if you need help with this process, you can make an appointment with me and I could go over it with you. One of the biggest services I provide is the Medicare Open Enrollment piece, which is coming up. It's October 15th through December 7th. And you can schedule an appointment with me to review your Part D drug plans if you already have one, or to look at your Medicare Advantage plans to see if they're still going to work for you in 18 as they did in 17. We're going to start out on the assumption that you're new to Medicare, that you're getting ready to sign up. So when can you sign up for Medicare? You can sign up when you're first eligible. Could be when you're 65 or under 65 with certain disabilities. Special circumstances are special enrollment periods, or between January 1st to March 31st each year. So I'll go over what the criteria are for these. For when you're first eligible for Medicare, when you turn 65, you have a 7-month period. That begins 3 months before the month you turn 65 or 3 months after. So 3 months before and then the birth month and then 3 months after. And it ends 3 months after you turn 65. After that, then you'll become, and if you don't sign up and you needed to, you will be in the general enrollment. So special circumstances. So maybe you turned 65 and you didn't sign up for Medicare Part B because you were covered under a group health plan. So if you're turning 65, you're still employed, or your spouse is employed and you are under their group health plan, you can defer your Medicare A and or B. I always like to back up and go back over. So if you turn 65 and you just said, you know, I just don't think I want to do Medicare, I'm going to go without insurance. Not really a good move. I never recommend that. Then you're going to have to wait till the general enrollment period every year between January and March. So when you sign up between that time, your Medicare Part B would start July 1st, and there are penalties for not signing up for Part B. If you didn't sign up because you were with a group health plan, then that's okay. Then you're in the special enrollment period. So you have the initial enrollment period was when you turn 65. If you don't need to do it then, due to group health coverage through a spouse or yourself, if you don't need to, then you fall under the special enrollment. That can be done at any time that if you lose the coverage or if you decide that maybe the Medicare coverage is better than the group coverage, you can do that. And if you just decide that you just don't want to, well then, and then something comes up and you say, well, I better get Medicare, you're going to have to wait till at least 6 months between January 1st and July 1st. So if you'd make that decision, after March of 1 year, you're going to have to wait a very long time. So just keep that in mind. So original Medicare, we're going to go through how Medicare works. So you've decided you're 65 or you stopped your group coverage. So now we're going to start with our original Medicare. So original Medicare, this is the original Medicare card now, but later in the presentation I'll show you the new Medicare card. It was one of the most exciting things that's happened in the last 5 years for me with Medicare is they have a new card and a new number. You're not going to have your Social Security number on there anymore. So we'll talk more about that later. So when you enroll in Medicare with your A and B, this is your card. There's different parts of Medicare. So that original Medicare card showed you an A and a B on it. And we're going to talk about what that is. So Medicare Part A is hospital coverage, and Medicare Part B is medical coverage. No matter what, when you're in Medicare, you're always going to have that Medicare A and B. Medicare Part A is your hospital coverage. That means if you were admitted to the hospital, not for observation, but admitted to the hospital, that's the Part A hospital coverage. That is for you being at the hospital, you being in the bed, you being taken care of by nurses, and you have IVs, and that's about it. Medicare Part B is your medical insurance. Now, medical insurance, the first thing you would probably think of is everything outpatient. So you go to visit your doctor, you go to the lab to have blood draws, you have imaging, MRIs, x-rays, anything. That's your Part B. Now, while you're in the hospital, when the doctor walks in to see you, he's Part B. When you take oral medications in the hospital, those are also Part B on Medicare. If you're in surgery, you have your doctor, well, while you're sleeping, that's the anesthesiologist, he's Part B. So all those things when you're in the hospital, you are using both your A and your B. So it is necessary to have both especially if you don't have other coverage. Now, Medicare Part C is an Advantage plan. In this area, the best way to describe Medicare Part C on a large scale is Kaiser. If you have Medicare and you have Kaiser, you have a Medicare Advantage Plan through Kaiser, okay? Their plan also includes Medicare Part D prescription drug coverage. We're going to go through what decision you make, which way you want to go. You're going to have your A and B, and you're going to have to figure out how to cover the other pieces. So Medicare Part D is your prescription drug coverage. That's something that you go to pick up at the pharmacy. You take home with you, that's your Part D coverage. So I want to go back a little bit, talk about your Part B late enrollment penalty. It's pretty significant. So if you decide not to sign up for Part B and you're not covered under a group health insurance plan, and then you decide to do that later, you would have an enrollment penalty, okay? So another thing to be aware of about the enrollment penalty, if you don't have Medicare Part B due to a spouse who is working and the spouse decides they're going to retire and they are going to be on COBRA, maybe you're 65 but your spouse isn't, and they're going to go ahead and go on COBRA with you. Your spouse is no longer working, so that Medicare Part B waiver is not in place. You have 8 months to sign up for Medicare Part B without a penalty. So I've seen this happen. Somebody will come in and say, well, we had COBRA for 18 months. And so they should have signed up 10 months ago. Now they're going to have a penalty for Part B for 10 months. So it's really important until you actually sign up for Part B to watch the rules and how they apply to you. So premiums, how do premiums work with Medicare A and B? So if you meet the qualifications for Medicare, which is working 40 quarters in your life, there's no premium for Part A. Part B ranges from $134 a month to $428.60. That was for 2017. Right before I came in here, I checked the Medicare website. They don't have the new numbers up yet. I could tell you over the past 8 years, it's fluctuated from 104 to 134. I haven't seen a big fluctuation. So why would you have to pay more than the 134? So if you fall into a higher taxable income, $85,000 for a single person, $170,000 for a married couple. So if you're a married couple under $170,000, you're going to pay around $134 a month for your Part B premium. If you make more than $170,000, then it's going to go up in tiers. You could start out at the $134,000, and this happens sometimes. Maybe you'll have an inheritance, you'll sell a piece of property, you'll cash something out that causes your income to go up. If that happens, then it is possible that your Medicare premium can go up as well. And I believe that lasts for 2 years. I'd have to double check because they do go back 2 years in your taxes. Deductibles. Medicare Part A, when you're in the hospital, the deductible is $1,316. That's for this year. And your Part B deductible is $183 as of 2017. The Part A deductible is each period that you're in the hospital. The Part B deductible is only yearly, so once you've met that deductible, you're good for the rest of the year. Part B coinsurance or copayments. They're really coinsurance. Once you've paid for your Part B deductible, so you go to the doctor charges you $200, and you pay the $183. The remaining balance, you're going to pay 20% of that. And then from then on, you're paying 20% of any of your medical bills. And I know that if you go to the hospital, coinsurance could be thousands and thousands of dollars. But as we move through this, you're going to see how we're going to fix that. Don't worry yet. There's a really good fix to that. So although many preventative services are covered 100%, most Medicare services are 20% coinsurance. Okay. We talked about the deductibles. We talked about that 20% coinsurance. We need to find something now to cover that 20% and those deductibles. Okay. So these are things to consider when choosing your Medicare coverage. I want to tell you, this information that I have just comes straight from the Medicare and You 2018 book. You can get it online through Medicare.gov, which that's also in one of your slides. So as we go through here, it talks about the difference between original Medicare and Medicare Advantage plans. With original Medicare on this side, you usually will have a Medigap. We're going to talk about Medigaps soon. Or you can go with the Medicare Advantage plan, and the Medicare Advantage plan takes over for your Medicare A and B. And I'm going to go through that more in a moment. This slide is just something that can give you a good comparison. If you look at the one that says doctor and hospital choice, I think is the one that's most important that I like to emphasize. So with original Medicare, and then I recommend you have a Medigap that we're going to talk about, you could go anywhere in the United States that takes Medicare, okay? As long as they take Medicare, they'll take whatever Medigap supplement you have as well. So it travels with you. So if you're somebody who travels a lot in the United States or you have another home in another state, I highly recommend that you do the original Medicare with the Medigap. If you go with the Advantage plan, you may need to use healthcare providers who participate in the plan's network. So what does that mean? In our area here, Hills Physicians are what most of the outside doctors are, Hills Physicians, with the exception of Palo Alto Medical Foundation. If you're with a Medicare Advantage plan, like AARP Secure Horizons, you might be familiar with that. If you choose Palo Alto Medical Foundation as your group, that's where you're going to go to get your services for your everyday health needs, your outpatient care. Our hospital does accept the AARP Medicare Advantage plan, and we also take PAMF as a group at our hospital. But our outside providers who are affiliated with the hospital, you would have to check with each individual one. So you want to find out about who the network doctors are if you're choosing an Advantage plan, what pharmacies you could use, and what is it for out-of-network coverage. So you might find if you are traveling, like I said, within the United States, and you get sick somewhere else, the emergency services are always covered. So if you don't be afraid to travel or go on a trip, but if you are just kind of, I have my cough turned into something worse, I think I need to get some medicine, you need to they require you to call the plan and say, let them know, hey, I'm out of my network area, where should I go to get care? They might tell you to go ahead and go to the emergency room, but you kind of have to get it pre-authorized. And I highly recommend that you get it pre-authorized so you don't come home with a big surprise. But I want to emphasize, if you have an emergency, always go to the emergency room. Don't wonder about your coverage. You'll always be taken care of. When I do little mini seminars in my office, I use this information, the 2 ways to go, okay? There's 2 ways to go here, but if you have an employer-sponsored retirement plan or VA, that's another sidebar. But this is the typical, most looked at way of looking at Medicare. So we have option number 1, which is original Medicare. We talked about you have your Medicare card with your A and your B. A is free. B could be around $134 a month, okay? So you have that card. Now, we know we have to pay 20%. So what are we going to do about that? Down here, we have our Medigap. Medigap is supplemental insurance, and it's lettered A through N, and we're going to talk a little more about that in a moment too. You choose one of those plans, and choosing Plan F is going to help you cover 100% of all the extra charges to Medicare. Now, Medicare Part D is your prescription drug coverage. I didn't talk a lot about the penalty, or actually at all about the penalty on that, but if you don't get your Medicare Part D when you first enroll in Medicare, you will have a penalty if you decide to sign up for it later. It's not as big of a penalty as the B, but it is there. With this plan, you can go anywhere in the United States that takes Medicare, and your Medigap follows. Doesn't matter who you buy the Medigap from. If the facility that you're going to takes Medicare, they have to take your Medigap, okay? Medicare Advantage. With Medicare Advantage, you still have to have your original Medicare. So you still have your A and your B with your card, and you're paying that $134 a month. But once you sign up for an Advantage plan or a Part C, you could put your Medicare card away. Don't get rid of it, just put it away, because you're not going to be using that. What you're going to use is the card that the plan issues you. Like, for example, Kaiser, you would have a Kaiser card, okay, with their Kaiser number. They also would cover your Part D. It would say Medicare prescription usually on it. Also, AARP, Secure Horizons, you would have a card from them. And then it would also cover your prescription drugs. And just real quick to talk to you about the differences you have with Kaiser. Kaiser, you're probably mostly familiar with. It's a very large organization. If you have to go to the Kaiser doctors, and there are several campuses here in the area. The AARP Medicare Complete Secure Horizons. If you have that and you've chosen your group, then you have to find the doctors that are in the network, okay? I do know that with the Hills Physicians, there's a lot of them around, and again, the Palo Alto Medical, so it's not hard to find a doctor. Those are your two choices when you're first choosing your Medicare. I want to talk about the Medigap supplement. So it's supplemental insurance that complements Medicare. It's separate from your Medicare. Medigap is a supplement that fills the gaps of coverage. The gaps of coverage are your 20% and your deductibles. And typically with A and B, recipients will purchase a Medigap plan if they don't have the Advantage plan. Again, they're lettered A through N. We're going to go over that. And they're sold by private insurance companies, but they're regulated by Medicare. And it doesn't matter who you purchase the plan from, it's going to follow your Medicare wherever it goes. I have people ask me, well, I understand that Humana is not really sold in this area, but I have a Humana Medigap plan, that's fine. It follows you everywhere. Okay, so these are the Medigap plans. This is what they look like. They're A through N with some letters missing in between. Plan F, right here. That plan, as you see, it goes 100% all the way down to foreign travel at 80%. So basically what this means is with the 100%, all this over here shows us the extra parts of Medicare that you would be paying for. And as you see with all the 100%, you're covered 100%. So what does that mean? If you go to the doctor, you bring your Medicare card, your Medigap card, you're going to be covered 100%. If you go to the hospital and it's a Medicare covered service, which most of them are, there's very little that Medicare doesn't cover medically. If you go to the hospital, you should have no bill at all. Okay, Medicare is going to pay their 80, then they let your supplement know, or your Medigap, hey, we're okay with this, we paid 80% of it. And then your supplement is going to pick up the other 20%. I call this the gold standard because you pay one monthly premium and all your services are covered. I have to have a caveat to that except for your drug plan, okay? So if you remember with your Medigap, you're going to have Medicare, a Medigap, and you have to buy a Part D drug plan with that. Well, again, we'll talk a little bit about that as we go along. With your Medicare Advantage plan, it's going to be all grouped in one, okay, one card. All right, so with the Medicare Advantage plan, you're going to have a monthly premium and co-pays. Every time you go to the doctor, the lab, imaging, you're going to have co-pays. Your drug plan in your Advantage plan, you don't purchase a separate one, they cover your meds, okay? But they are still going to have co-pays. I would say with my experience in talking to people from what I've seen, Medicare Advantage plans cover drugs, I think, just as well as your individual Part D plans. I'm sure there's at some point where, it teeters a bit, but I haven't gotten a lot of negative feedback about Advantage plans and their drug coverage, okay? If you're starting out with Medicare, I highly recommend that you get the Plan F. So let me go over a few caveats of this. I would call them Kristi's rules that you don't have to follow. When you're 65, the reason I recommend you getting Plan F is the coverage is the best coverage. Another rule to Medigap is you could always go down in coverage, but you can't go up. If you start out at, let's say, Plan N, and you say, well, you know what, I'm having to pay a lot of copays. I've been going to the doctors a lot. I think I wish I had Plan F. I want to go back. You can't go back. You can only go down in coverage. So my rule of thumb is this. First of all, when you turn 65 and you start out with Plan F, there's not a big difference in these two plans as far as the premium. The premiums aren't that big. I don't like to quote prices. I'm not quoting prices. I'm giving you an idea of what I've seen on the insurance websites and such. Plan F is usually at 65 around $135 a month, okay? Plan N is not significantly lower. So with Plan N, I should tell you this. The little asterisks there, there's a notation below that's not showing on the slide. Those asterisks mean that you would pay $20 at most of your visits. So if you're going to just your primary care physician, you'd probably pay around $16. And if you're going to a specialist, you would pay $20. The other missing piece here is the Part B deductible, which is $183 for the year. And then the Part B excess charges, which rarely come into play. Part B excess charges are if you end up at a facility that doesn't take Medicare assignment, they'll take Medicare payment, but there's an extra charge. Plan F picks that up. Plan N doesn't, although it really does not come into play very often. I don't think it's a big concern. But if there's not a significant difference in those two premiums at age 65, and you're going to the doctor once a month or even every other month, you're going to eat up the savings between the two premiums, so you may as well just start out with F. So why would you ever change and go down in coverage with this Plan F? Well, once you hit around 72 to 78, you're going to notice that your Plan F premium is going to start going up more. Could go up into the $200 range. That starts hurting after a while, you say, especially if you're pretty healthy, you're not going to the doctor a lot, and you're saying, gosh, I'm paying an awful lot for this supplement. Well, I always recommend you go back during your birth month. You don't change this during open enrollment. You change them during your birth month. I recommend that you go and talk to a broker and let them know that you might want to make a change during your birthday. Then you want to weigh out the price difference. Usually it's pretty significant. Most people change down to Plan N unless they're going to the doctor once a month or twice a month. Then it's not worth changing. But if you're going to the doctor every other month, it is worth changing, okay? So that's kind of my rule of thumb. These two plans right here, K and L, they look pretty good if you're not going to the doctor very often, but it really takes one hospital stay to really wipe out what you saved in your monthly premiums on that. So it's just not a safest plan to go. And again, if you sign up for them, those are your new plans. And the only where you could go is down. So again, that's why I'm a big advocate for getting that Plan F. Does anybody have any questions up to this point? Her question is are you paying the same amount if you choose original Medicare or you choose an Advantage plan? No. I'm going to throw some numbers out here that I've seen, again, on the websites. Original Medicare, let's say you're paying $134 and you choose the Advantage plan, you still have to pay for the Part B, okay? The Medicare Advantage plan has a premium. So if it's $100, then you're going to pay $134 plus the $100. Okay, so that's $234. That's the only kind of math I like to do. That was easy. Okay, so $234 you're paying. Now, when you go to the doctor or hospital or any other services, you're going to pay a co-payment or co-insurance. So it's $134 plus whatever you're paying for those extra services. Now, if you choose original Medicare with a Medigap, and you also have to pick up your Part D, the average price is around $300. So we're looking at, what, $66 more a month for the Medigap? But it's a known that when you go to the hospital or the doctor or imaging labs, you're not going to pay anything more than that. So with the Medigap, you are paying around $300 a month, but you have no other payments besides your Part D copays. Medicare Advantage side, you're still paying that $134. You're going to pay your Advantage plan's premium and, of course, copays for your drugs. So those are a wash for each other. But then you're going to pay that co-insurance and co-payments when you go to the doctor, hospital, or outpatient services. So that's kind of what you have to weigh out. Typically with the Advantage plans too, I didn't mention this and I may have a slide further down on it. With the Medicare Advantage plans, when you go to the hospital, usually the first 1 to 4 days that you're in the hospital, you pay on average $300 a day for the first 4 days. And that's every time you have a hospital occurrence, up to a maximum out of pocket of, I think I just looked at Kaiser's, I think it was $5,300. So once you've reached $5,300 out of pocket, then everything is covered 100%. So if you do the math on that $5,300 out of pocket, you know, what you save per month going with that. Again, it's a personal preference and how you want to spend your money. So your situation is that you are going to be 65 in July and you're still working and you're under a group plan. Probably are not going to retire in July. You might wait a while. Is that what you're thinking?
Another year to year and a half.
Okay.
66. So.
Okay, so you do not have to do anything during your birth time, when you turn 65, you don't have to do anything because you're under that group plan. And I think your question was, is there an advantage to waiting or not? Well, if you have a good group health coverage, that is how I always kind of play it out, is it less than $300 a month out of pocket for you? If it is, then I would stay with the group health plan. The other advantage to staying with a group health plan is usually the drug benefits are better, and also most group plans include vision and dental where Medicare doesn't. So those are the kind of things you need to weigh out. Most group health plans are better than going on Medicare for those reasons. So there would be no penalty for you. So let's say July, you turn 65, you don't do anything. Although, little sidebar to that, I always recommend just signing up for Part A. If it's due to you, go ahead and sign up. There's no cost. And then you're on their radar. You'll get some mailings, things that are useful. Then let's say in December, you say, well, you know, I don't want to wait till I'm 66. I want to retire in December. You just notify Medicare. I think it's important to do it about 3 months in advance. You could do it as little as 1 or 2 months, but it's a little risky on when you're going to get covered. And then you can sign up for your Part B, let them know when you want it, and typically you want it after your other coverage ends. And note, there's no penalty. You could jump on the B, you could get a supplement, and you can pick up a drug plan.
Okay, so there would be no point of having both at this point.
No, not unless your group health coverage doesn't cover you well, and you would need more coverage, yeah. But the best way to go is, especially if you've had a PPO, I always recommend that you start out with a Medigap, because it's also easy to go from a Medigap with your original Medicare over to an Advantage plan during open enrollment. Easy switch over. Not so easy to go the other way. Most people just have a plan like that, where they say a certain month. It's not a good idea to just say, I'm leaving tomorrow. So that's good. So if you know when you're leaving, I would give yourself 3 months before your other insurance is going to end, as long as it's not COBRA. Yes. So what you would do is you're going to contact Social Security. You could even do it online. I can help you. In December, I'll be really busy because of open enrollment. But you could go to online to Social Security and get the forms, and you fill them out and say, this is because you already have Part A, okay? You get the forms and you fill them out. One thing that you're going to need, there's a form in there that you have to take to your employer. They have to sign saying that you were covered from age 65 to when you're retiring. And that way you won't have a penalty, okay? But rule of thumb is 3 months. Yeah, and you do your B first, and once your B is in place, you get the letter from Medicare saying when it's going to start. Then you could go to the insurance company or insurance broker, and the broker can then have that information and sign you up for your Medigap, and then I or they can sign you up for Part D. When I sign people up, help people sign up for Part D, I don't sell insurance. What I do is run you through the Medicare website and show you how to navigate the plans, and I help you understand what the costs are. So, okay, choosing a Medicare Advantage plan, we're going to get a little deeper into that now, and the Medicare Advantage plans are a little more details to them. On the Medicare website is where you could go, put in your zip code, and it'll tell you what Medicare Advantage plans are available in your area. We'll be going through that. Now, in our area, I think it said 6, but out of the 6, 1 is accepted here, 1 is Kaiser. There are 2 Stanford ones, which, if you were at my other seminar, I haven't had a chance to look at those. I have a feeling they work with Palo Alto Medical. And there's a Humana plan, but we're not in their network. So basically, for all intents and purposes, we definitely have 2 in this area, possibly 4. Okay, so you find it in your zip code. So we're talking about the Advantage plans that they're called Part C or MA plans. They're offered by private insurance companies who are approved by Medicare. And you don't use your Medicare card with them, you use the card the Advantage plan gives you. The rule with the Advantage plans, they have to cover at least what Medicare covers. So when you're looking at the Advantage plans and how they're covering, they might say doctor visit $10, $15, $25, copay, right? If you see anything that says 20%, well, what that tells me is that they're really not covering you. They are covering you, but Medicare, it's the same as Medicare. Medicare's doing 80, you're paying 20. Well, they're not covering you on that. But because you're paying for your Medicare, Medicare's paying the plan to take care of you, okay? So they have to cover at least all the original services to Medicare. They offer extra coverage such as vision and dental. It's kind of like a bundled package. So if you sign up for Kaiser, they'll say, do you want the dental and vision plan for an additional fee? You could do that. If you do a Medigap plan, you could talk to a broker. I think it's easier than trying to navigate the website to see who's selling what in what area. You can get dental and vision plans, but typically they are just not, they don't cover that well. They usually, it's pretty much of a wash. With that said, if you have a group coverage, I always recommend doing, let your dentist know you're losing your coverage, and just make sure you get everything done, and do all your vision before you leave, so it'll set you on your way as visually and orally as healthy as possible. So Medicare Advantage plans are not supplemental coverage. They don't work with your Medicare. They work instead of your Medicare. And each medical Advantage plan can charge different out-of-pocket costs and have different rules on how you get services. And the rules can change every year. That's why during open enrollment, you always want to review your Part D drug plan. And if you have a Medicare Advantage plan, you want to review that. Because if you're with your Advantage plan, if you're getting certain services that are maybe like chiropractic, or they have some extra coverage, you want to make sure if you're using those every year that they have them again the next year, okay? Or maybe your medications. You want to see how they're covering your medication. So if you have medication, a lot of people, there's generics, but some people can't tolerate it. So they get the brand name, and maybe it's covered under their Advantage plan, but you want to check every year to make sure. That goes the same for Part D. You want to make sure your drugs are covered the same. Or you want to find out if there's not something better that's out there too. Okay, so questions to ask when choosing an Advantage plan. You want to find out what medical groups are included in the plan, so that way you won't have to change doctors. You also want to ask your doctor if they're part of that plan, and if they are, what group are they in, so you coordinate that. What hospitals are in the plan? Does it cover your prescription medications? We just talked about that. And what are the co-pays and co-insurance? What are the out-of-pocket maximums? So those are the questions you want to find out to navigate your Advantage plan. Okay, so now we're going to talk about Part D prescription drug coverage. Now the rules for Part D apply in the Advantage plan just like they do if you're buying your own Part D. Okay, the donut hole and so on, co-pays and everything else. So if you have Medicare Part A and B with a Medigap, you do want to add your Part D prescription drug coverage. Sometimes people aren't taking any medications when they sign up for Medicare, so they say, well, I don't really need a drug plan. But you could have an event during your life that requires you then to have to take medications. If you don't have that drug plan in place, then first, when you have to sign up, you're going to have a penalty. It's not a huge penalty, but it could be $20 a month for the rest of your life. And also, you can only do it during open enrollment. So if something happens to you in January, you might have to wait till October to sign up, and it doesn't take effect till January. So keep that in mind. There are several plans offered by private insurance companies. In this area, when I looked, I think I saw 27 plans. And depending on your coverage, you may pay a monthly premium and sometimes a co-payment depending on the plan. So the plans range from $17 all the way up to over $100 in premiums per month. And they have different deductibles. Some have no deductibles, some have a small, some have a larger deductible. And how do we determine what Part D plan you should get? Well, when we go on the website, and I'll show it to you, it's based on your medications. So let's take a look at that website. This is the Medicare website if you haven't seen it. Just before you guys got here, I went in here and I searched Medicare and U 2018. There you go. So if I hit that, it's going to populate like a Google page, and you pick it, and the PDF of the new book is up. And I'm going to say, this year, they had a lot of interesting things in there. They were all positive. Every year it's been positive information, so that's good. But right now, what I want to show you is the Advantage plans and the drug coverage. So we go under Part D coverage, and I go to Find Health and Drug Plans. The health plans are the Advantage plans. So here's your Medicare Finder. If you're already on Medicare, I recommend you go ahead and fill out this information, because once you do that, it's going to know who you are, and it's going to give you information that you may have already signed up for. It'll give you a lot of information, but since we don't have that, I'm going to go ahead and put in our zip code. You still can do the same things, it's just not personalized. Now we go here to how do you get your Medicare coverage? Well, I'm not getting any Medicare coverage right now. I'm just helping you, so I'm going to say I don't know, because it will take me right to where I want to go. You can play around with this and see what other information it has. The Medicare website, I like it. It has a lot of good information. Okay, now step 2. So we entered our area. They know where we live. Now we want to enter our medications, because what we're doing here, we're going to either choose a drug plan or we're going to choose a health plan, and we want to know how that health plan is going to cover our drugs, right? So I'm going to put torvastatin because it's pretty popular. I put in 40 milligrams. And this site, if you're going to do this at home, do it by the month. Okay, don't say, well, I get it every 90 days, because it just doesn't come out right. It recommends you do it on a monthly basis. I'm going to do Novolog insulin, the Novolog Flex Pen, another popular insulin. This has packages of 5 pens, and let's say I get 1 box a month, okay? Another one I'm going to put in here is, I don't remember the name of my generic, but I know it's Plavix, and I take 75 milligrams a day once a day. I get it every month. Even if I get it every 90 days, I'm leaving it there. I always say I get this medicine from a retail pharmacy. If you start getting into the mail order and the 90 days, it just really gets confusing. There's a way to break it down later in this program. Oh, look at here. So there it is. That is what I take. I don't take Plavix. So I'm going to use that generic. Before I leave this page, as you see this drug list here, I'm going to go ahead and print that page at home or jot that number down with my password date, because if I want to go back into the Medicare website, I can click here on use a different ID list and put in this number, and what it's going to do is repopulate my drugs for me. That way I don't have to keep entering them every time I want to go in. If you do this and you've put your personal information in with your Medicare information, it's going to just naturally repopulate it with the medications. You could also, if your doctor took you off of something or you think you might not be taking anymore, you can remove it, or you could also change your dose here. Okay? So my drug list is complete. Now it needs to know what pharmacies I like to use. I happen to know that there's a really good Walmart plan that covers generic drugs really well, and it has a very good mail order. So I'm going to look for a Walmart. Doesn't matter which Walmart, they're all in my zip code. And then the other one, last year at least, there was a AARP Walgreens. So now I've chosen where my zip code is, what medications I take, and what pharmacies I like to use. Also, if you're from this area, and I just put Walgreens, it has CVS, it has Haller's, Raley's, it has Safeway, Lucky's. So wherever you like to use, I always, if somebody comes into me and says, you know, I really like my Safeway pharmacy, I always put Safeway in, and then I put Walmart. And you could go back and play with this a little bit, but that's usually where I like to start. So here, I'm just going to start with the prescription drug plans. We're going to assume that you have Medicare A and B, and that you've chosen a Medigap. So now we need to choose a drug plan for you. So we go in. Now, if we had used your personal information, it would already show you right here what plan you're on, if you are on one. This just shows original Medicare. Now, it's going to show me 25 plans that are in my zip code. It shows here that I'm now viewing plans for 2018. So that means this will be from January to December. It's starting off with SilverScript, and it goes on down. Now, if I were to sign up for SilverScript, what it's telling me is that I'm going to pay $1,742 for the whole year. If my medications don't change, I pick them up, just like I put them in every month, and I pay a $28.50 premium. This includes all my copays, and it includes my monthly premium. That's what I'm going to pay for the year. It's a great little budgeting tool, okay? That looks pretty good. And if I go mail order, I'm going to pay $16.38. Okay, so I save a little money there. What's the next one? Aetna. Well, it's more. It's $19.63, and the mail order's higher, so not so popular. Now, I also kind of like the Silver Script has no deductible. Sometimes there's a hefty deductible of around $350. Some people say, well, overall though, it's cheaper for the whole year, but it has this bigger deductible. Again, that's a real personal choice. Some people say, well, I don't want to put all that out in the beginning of the year. I'd rather pay a little more throughout the year. Again, those are just decisions that you can make as you go. So I'm liking this, so I'm going to go ahead and pick it. Usually it's pretty straightforward, but sometimes you might be taking things that you don't take every day. Something that might be really expensive, like a breathing medication, but you only take it during allergy seasons. So then you kind of have to play with this more. So we're into the plan here, and it's $28.50. Here's your premium. There's no monthly health plan because this is not an Advantage plan. This is a Part D plan. And there's no drug deductible, which we like that. And we look here, we chose Walmart and Walgreens. So not a big difference there. So you can pick the one you like. And then the mail order pharmacy is just a little cheaper. So I would use that more for convenience. Now you don't have to pick all your drugs up every month if you started out at the beginning of the year, you just got a 90-day supply, so you don't need them for 3 months. You only pay as you pick up. So here we have from Walmart. My atorvastatin at Walmart, if I pick it up, is $6.06 every month. My Plavix or generic is $3.34, and my Novolog is $47 a month. So if I were to pick up all my drugs every month, it would be $57 a month. This is what the full cost of the drug. If I didn't have this plan, I would pay $549 a month for my medications. This is the coverage gap and catastrophic, so we're going to go talk about those here. As I go down here, right here, the gray is my premium, which is $28, and my copay is $57, so that makes my $86 a month, okay? So I pick up all my drugs in January, I'm going to pay $57 at the pharmacy. It goes without saying that you're going to pay that premium every month. So it looks green, and I'm going to be paying that all the way till July. When I get to July, I've used up my Medicare allowance, and now I'm going to pay, it's going to be a blend of 34 of my gap and 57 of my copay. So how did I run out of Medicare allowance? Well, every time I went to the pharmacy and I picked up my medications and I paid $57, they reported to Medicare the $549. And you have about $3,000 in Medicare allowance. That's a rough number. So it took me this long to use up my Medicare money. Now I'm in the gap, okay? The gap is also called the donut hole. So while I'm in the gap, I'm going to pay $193 a month for my medication. If you look here, I went from paying $6 to $2. It's cheaper in the gap because these are generic drugs. My Novolog is a brand name drug, so I'm paying more. If I were to get out of the donut hole because my total out-of-pocket reached around $4,800, then I would go down to catastrophic level, which is $33.69. So donut hole or gap does not look as delicious as something called catastrophic, which sounds horrible, which is actually, I guess it's horrible that you just had to pay that much money, but now it gives you a little relief. And then again in January, it starts over. Let's look real quick here at the mail order. The savings is reflected here. If you do mail order, there's no charge for those two medications. And this is $105, and then it shows you here, you're going to hit that gap in July, and you're going to pay a lot more because you're getting it for 90 days. That's why it's so much more, because then you don't pay for it again until you're here. I'll take questions on this now. Her question is, are you allowed to use the drug discount cards that you find that you can get online and so on? You can try. Some of them won't work if you have a Medicare Part D coverage. A lot of times those work for those who don't have any coverage. But I always recommend you try. I have heard people say, oh yeah, they accepted it, but more often than not, if you have coverage, they don't. If you're taking your Social Security benefit and you're not 65, but you have Social Security, when you turn 65, they'll send you a card, and you could decline the B and just have the A. As far as being automatically enrolled in Part A, I haven't heard that. Usually people sign up for Part A. Let's go back Just want to show you the Advantage plans real quick. I'm going to check Medicare health plans with drug coverage. These are Medicare health plans. So it shows that there's 6 plans. HealthNet Ruby Select. Here's the 2 Stanford Care Advantage plans. There's 2. They have 2 different premiums, and that's more than likely because they have different types of coverage within them. And we'll look at some of the coverages here. Another HealthNet. There's the AARP Medicare Complete, and here's their premium, $97. So if you look at this one's $157 for the HealthNet. Well, you're going to be paying $134 for Medicare, then $157. It also includes your drug plan. So you're already looking at close to $300, and then you know you're going to have copays. To me, that doesn't make sense. The money you're going to save, you go to the doctor once, and there you go. We're in the Kaiser plan. Let's look at it since we're here. The $134, that's for your Part B, and then you're paying for the plan of $94, and then the drug plan. All right, so let's look at the health and drug benefits. So this is what we want to look at. So it says 64 because the 97 also includes the drugs. So you can't do one without the other. It has a $6,700 maximum out of pocket at Kaiser. Once you've spent that much for the year, then everything's covered. It has optional supplemental benefits. I believe those are more than likely the vision and dental. So here, if you were to go to the hospital for the first 7 days, you're going to pay $285 every day up to 7 days. Okay, so that's going to keep happening until you've reached your out-of-pocket maximum. Your doctor visits are $35 per visit, and so are your specialists. Preventative care is zero pay. The reason that is because they have to cover like Medicare does. Preventative services there's no charge. They're free. Okay, look at a little more. If you go to the emergency room, it's $80, urgent care $35. Now all these that we're looking at, if you have a Medicare with a Medigap, it's all free. You could go through and look at these details. So if you wanted to sign up for a Kaiser or any of these Advantage plans after the 15th, you can do it online. If I was to change this over to view 2017 plans, it's going to show what you'd pay this year. And you can sign up now. So if you're turning 65 next month and you want to go ahead and sign up, you can do that. Okay, now we're going to talk about the more medications. Some medications are covered under Part B. One of the common things is breathing medications and insulin. So if you have insulin and it goes into a pump, your insulin is covered under Part B. So even though you're going to go pick it up at the pharmacy, you need to let the pharmacy know, and your doctor needs to write the prescription appropriately that insulin is going into a pump. And in that case, then you're covered under Part B. Now, what does that mean to you? Well, the insulin's kind of expensive. So if you have it under your Part D drug plan, you're going to hit that donut hole. And then you're going to go catastrophic at some point. So you're going to pay a lot. It's also going to eat up your allowance for your other medications too. But if you have it under Part B and you have a Medigap, well then it's free. And it does not affect your donut hole or gap. So that's something to remember. Also, things that go into a nebulizer. Drugs that go into a nebulizer oftentimes can be taken through other ways. So if they're in a nebulizer, that's a durable medical equipment. So durable medical equipment is covered under Part B. So therefore it's covered with your Medigap 100%. If those situations apply to you or family members or anyone you know, and they have an Advantage plan, that is something you always want to look at in your Advantage plan. How will I be charged? Also, injectable osteoporosis drugs and injectable infused drugs, like infusion, like chemotherapy, anything in an infusion center, that's all covered under Part B. Oral end-stage renal disease drugs and enteral nutrition, which is like a feeding tube. You pick up that food at the pharmacy, but it's covered under Part B. Your pharmacist doesn't always know where it's covered under. They're used to you being on Medicare and then it goes through your drug plan. So you always have to make sure they do it correctly because it can be reversed, but really nobody wants to go through the paperwork hassle of that. Okay, employer-sponsored plans or veterans benefits. Okay, so we talked about our Medicare with a Medigap, our Advantage plans. We also have group health insurance. You have coverage as a retiree from an employer, or somebody might still be working and have Medicare coverage as well as their employer plan. So open enrollment might be different for that plan. So I'm not sure when yours is up. So we have Medicare open enrollment is October 15th through December 7th. Yours may end in October. It might have already started and it might end in October or November. So you have to kind of gauge that so you don't miss your employer's open enrollment. So extra help. Extra help is basically Medi-Cal. If you qualify for extra help, like you're having trouble paying for your medications or for your Part B drug plan, you may get extra help. Social Security is tied into the federal government that knows what you're filing for your taxes, that knows what your income is. So they're very helpful. I have to give them this. They will send you paperwork that says you may qualify for extra help. Well, even if you don't think you do, I would go ahead and fill that out. There might be something that you don't know. And they might come back rejected, but I always recommend most people who get the paperwork, they'll stop in and say, Kristi, I got this. What do you think I should do? And we say, well, let's fill it out. We fill it out and send it in, and most of the time it's covered. If you get extra help, they'll cover your Part B premium of $134, and they will cover your Part D premium, and your co-pays on your medications should not ever be any more than $3.60. So they're either free or up to $3.60, and the coverage gap does not come into play. So you never fall into the coverage gap. Talking about part of free services from Medicare. So yearly wellness exams come into play, and even if you have an Advantage plan, it also comes into play. So basically what they do is review your medical and family history, develop or update a list of current providers, check your height, weight, and blood pressure or routine measurements, and personalized health advice. Now, during these yearly wellness exams, if they need to do anything diagnostic, it's no longer a wellness exam. That part of the exam will still be free, but they'll charge you for the other piece, okay, once they have to do diagnostic. Like for example, personalized health advice. If you're telling them, yeah, I've been feeling really bad, and you look really pale, and they're saying, hey, I think we might want to do some blood work. Well, now we're diagnostic. We're no longer wellness. So that can happen. But if you're under so what could happen to you? If you have a Medigap plan, you're not going to pay anything. If you have a Medicare Advantage plan, it went from free to maybe $10 to $20, okay? If you have no coverage, well, you're now paying 20% of that office visit. I actually had that happen the other day. Somebody was kind of upset that they went to the doctor and they said they just wanted a wellness exam, and then when they got their labs back, they got a bill. And I said, well, that's because it was no longer wellness. So another thing, I thought, this comes up every now and then. So your doctor or other healthcare provider may recommend you get services more often than Medicare covers. You might have a certain health condition that the doctor says, I want to see you more than every 3 months. Maybe they're trying to gauge new medication or something. Medicare may not cover it. If that happens, if your doctor lets you know it's not something Medicare normally covers, then you want to find out in advance what those costs might be. And you might want to tell your doctor, if it's going to be pricey for you, maybe you could say, can I, pay a little every month in advance? You just want to know. People don't like to be surprised by getting a medical bill after they thought something was covered. So just be aware when you go to the doctor, if it's something that's not normal and they want to do something different, go ahead. It's always good to ask the question. Just say, I'm wondering, we haven't done this before. Is this covered by Medicare? I never recommend you tell your doctor, no, I'm not going to. They're trying to help you, so don't tell them no, but be aware of what it is and what it might cost. I've talked about it ad nauseum that open enrollment is October 15th through December 7th. If you're already in Medicare and you want to make changes, you have between October 15th to December 7th. If you have a Medigap plan, you do that during your birth month, not right now. If you were to sign up for a Medicare Advantage plan, and once you get the plan information and details, you decide that, you didn't realize what you were signing up for, you don't like what you're reading, you can change it from January 1st to February 14th. You can switch it back to original Medicare, get your Medicare Part D plan, and a prescription drug plan. So you can do that. I think this is important because I'm going to talk a little bit more about scams, which I don't think this is a scam. I think it's people that don't understand how the Medicare system works. There are some of the companies that are available in the area, they have very high-powered salespeople who call you, and this is a classic. Let's say I have an AARP Medigap plan, and they call and say, do you have a AARP plan now? Oh yeah, I have AARP. Oh, do you have the drug plan? No, I have another one. Well, ours is it's cheap. If you just pay this much a month, you're going to be covered for your, they'll tell you it's a supplement and a drug plan, and it's all in one package. Well, they just sold you an Advantage plan, and when they did that, they kicked you out of your Part D and your Medigap. And now you're in an Advantage plan, and maybe the doctors that you're seeing aren't in those plans. So this little caveat here helps you get out of that. So that I see happen, You know, I only see about 400 people a year during open enrollment. That's not a lot in compared to all the people in this district that are not coming and being proactive and getting help with their Medicare. Okay, this is the big Medicare news. So excited. There's a new Medicare card and number. Now, I can't confirm nor deny that this is what it'll look like, but this is from the Medicare and You 2018 book. So the new Medicare card may look like this. These are the new numbers. They are randomly selected. So you will probably never remember your Medicare number again. It used to be your social with an A or a D or a T at the end. So they're random. I feel it's a very secure number. For the most part, it looks the same. It's just going to be changing the number. So one thing that I thought was really important to know, and you know, I've been talking to people about it for the last 2 days, is make sure your mailing address is up to date. Some people may, you know, they may have moved, and if you're not getting mail from Social Security, maybe you moved and forgot to change your address or something happened along the way, make sure that they have your mailing address so that you get your card, okay? They're going to start being mailed out in April of 2018, and not everybody will get their card at the same time. So this process will take, I think they said it could take up to the end of 19, but I could be wrong. So it definitely starts April. So just keep using your Medicare card if you have one now until you get your new card. There is a transition period for the providers, so they should be able to use either card. But just be aware that maybe, you know, your neighbor might say, oh, I got my new Medicare card, and you might not have, so it's not by the neighborhood. This is really important. I hadn't thought of it, is beware of anyone who contacts you about your new Medicare card. So this, you know, this is an opportunity for people to scam and get Social Security numbers. Beware of anyone who contacts you. They'll never ask you to give personal or private information to get your new Medicare number and card. So if you get a phone call from someone who says, hi, you know, we're trying to get you your new Medicare card, but we've seemed to have gotten your wrong address. Can you give me your Social Security number so I can make sure that you have your right address? You know, you're sitting there watching TV, having some popcorn, you get this phone call, you're like, oh, okay. So really be mindful of those questions. Did I call you? I didn't call you, so how about I don't talk to you, you know? And then you could make that call the next day and say, I got to Social Security, let them know you got a strange call, and you want to know if they need your help identifying you, okay? So scams, again, be aware, during open enrollment especially, insurance people will show up at your door. They're not necessarily a scam, but they're not going to always give you clear and concise information that you need. Can you blame them? They're salesmen. They're trying to get you to buy their things. So, and they're only selling theirs. So health insurance companies have to be licensed. So if you get something that doesn't sound at all familiar, first question, are you licensed in the state of California? Can you send me some information? If they won't mail you anything, they need more information from you first. Right off the bat, don't talk to them. So before you purchase a plan, you should ask for the details to be mailed, and if they won't, you really shouldn't deal with them. And be aware of phone calls and mailings that you did not initiate. I like the phone call one. If you didn't call them, then why are they calling you? So there you go, and there's my number. It's on one of your slides. I am taking appointments for Medicare Part D. I'm also available all year. I have people come see me right now that are going to go on Medicare next year, just to kind of get an idea. So I do a little mini seminar, and you could ask more detailed questions. All right, thank you all for being here tonight. Have a good night.